Do you have that one friend who seems to know an insufferable amount about a lot of random subjects? The person who chimes in with the odd and sometimes highly disturbing fun fact. Well, my name is Carly, and I am that friend. I often find myself wondering about topics that range from the history of certain holidays to what makes some wines expensive and some a little on the cheaper side. So I make use of that mini supercomputer I carry everywhere and just look it up. Lately, I have decided to share the random knowledge that I acquire with all of you lovely listeners. So welcome to I'm Already Looking It Up. Let's have a drink and learn a thing or two. Hello. You're listening to I'm Already Looking It Up, the podcast where I, your host, research a random topic and tell you, my lovely listeners, all about it. So without further ado, let's get started. So, the topic I'll be talking about for this episode is another kind of, a lot of these are some of my favorite things to talk about. But this one is kind of fun because we're going to talk a bit about old wives' tales, or in general, just like things you've been told that will help you treat something medically or something along those lines that don't actually work as well as we think. One reason I wanted to talk about this is I often tell people that peeing on a jellyfish sting won't help, and please don't do it because it will make things worse. And they never believe me because it's such a popular myth that you should do that. So I'm here to break my silence and say definitively, please don't pee on jellyfish stings. But we're going to talk about some other things. So the first one, we're obviously going to talk about peeing on a jellyfish sting. That's just what I started this episode for, so I figured we'd start with it. So, the myth is urinating on a jellyfish sting will help. False. A sting from the tentacles of a jellyfish can cause significant pain. Although some say peeing on a jellyfish sting will help to reduce the pain, there are better and more sanitary ways. Rinse the area with vinegar or salt water to help stop the stinging cells from causing pain and swelling. Avoid rinsing with fresh water, as this could inflame the area and result in increased discomfort. Seek medical care for intense pain or swelling, or if you experience any chest tightness or difficulty breathing after a sting. As a reminder, it is always best to urinate in a restroom instead of a friend at the beach. Urinate in a restroom instead of on a friend. Don't pee on your friends. It's not very nice. And it won't help. It will not help at all. Do not do that. The next one is an apple a day keeps the doctor away. While not true, fruits and vegetables are good for your health. When researchers pitted two groups of people against each other, those who reported eating an apple a day and those who didn't, they found no difference in the number of doctor visits. They did, however, notice that the apple eaters took fewer medications than those who didn't get a daily dose of the fruit. The adage likely evolved from a desire to get people to eat more fruits and vegetables, at least 3 to 5 servings daily. So while eating an apple a day may not keep the doctor away, increasing your fruit and vegetable intake is good for your health. I think a lot of people know that one's not real. It's more of just like a saying, just to get people to eat a little healthier. So, kind of normal. All right. The next one is chicken soup cures a cold. Somewhat true. Chicken soup has been shown to reduce inflammation and thin nasal mucus. The hot liquid also helps to soothe a sore throat. The reality is, it doesn't much matter which type of soup you choose. Sipping any warm, comforting soup helps soothe coughs, sore throats, and inflammation and provides needed fluids. While there is no cure for the common cold, chicken soup can help alleviate symptoms. You should also definitely have cough drops. I For a very long time, hated cough drops. I refused to use them. I always used peppermints instead because I thought they were better. Yeah, I mean, you can, and it does help a little bit, but cough drops are kind of where it's at, just because they're medical and they have the needed medication on them to help soothe your throat. The last time I was sick, I had a whole bag of cough drops to myself. I probably went through it in a couple of days of being sick, so use cough drops. They're great. But chicken soup is great too. My parent, I don't know that my parents used to make us chicken soup every time we got sick, but it was always nice. In the middle of winter, we would make these huge pots of chicken noodle soup to be served with mashed potatoes. And it was always nice to have that because we would have so much left over that if one of us got sick in the winter, which we were all prone to doing, we had chicken noodle soup that we could eat, and it reheats real well, so definitely. The next one is honey soothes a cough. True, adding honey to your tea or swallowing a teaspoon when you have a hacking cough has a scientific backing. In fact, both the World Health Organization and the American Academy of Pediatrics recommend honey as a cough suppressant, not only because it works, but also because it gives you the greatest bang for your buck. In a study of children with upper respiratory infection, 1.5 teaspoons of honey decreased cough and improved sleep better than over-the-counter cough syrups. Scientists believe that the antioxidant and antimicrobial properties of honey coat the throat, soothing the rawness. The catch: you can't give honey to children less than 1 because it may contain spores of bacteria that can lead to infant botulism. It also should not be taken daily because honey has sugar, so swallowing a teaspoon daily can lead to cavities. So, use honey, but in small doses, literally. Cold temperatures bring on cold and flu symptoms. Mostly false. People tend to get more viral illnesses when the weather turns colder, but not because of the wind chill. In fact, when researchers took a close look at the issue, they found that people living in Antarctica were no more likely to suffer from cold and flu than when the same group of people were living in those warmer climates. Cold and flu are caused by viruses, and when you spend more time indoors, germs spread more readily, which may be why we see higher rates of colds in the colder months of the year. It makes sense. You're closer together, you are around people more because everyone's usually inside. It makes sense for school and people who work full-time as well because you are home more often because it's, a winter break kind of area. So yeah, it does make sense. I could see that. The next one, feed a cold, starve a fever. True for a cold, false for a fever. The reality is that you should feed both. When you're under the weather, your body needs energy to bolster your immune system and fight off infection. More important than food, though, is fluid. When people are very ill in the hospital, doctors' first response is to give them fluids. If you're sick but not hungry, you don't have to force yourself to eat, but you should always drink plenty of fluids. Water, of course, but also tea, broth, or soup. If you struggle with heart failure or kidney problems, talk with your doctor about the amount of fluids you should be drinking. There you go. Always feed a cold and feed a fever as well. And that's what people tell me whenever I get sick. I do get sick pretty often because I have an autoimmune disease. I guess not pretty often. I think I've really worked a lot on my own health in the last few years that it's gotten a lot better. But in the winter, I'm always stuffed up with a cold or something like that. But yeah, you should definitely drink lots of fluids. It's really good for you. Again, I should put as a caveat to this podcast, I'm not a doctor or a nurse. I'm literally reading these articles and just kind of commenting on them. Definitely ask your doctor if you think it's necessary. But these are just common things that help a lot when one is sick. So the next one is the flu shot causes the flu. Not true. People who get the flu shot may experience redness and soreness at the injection site. They might even suffer from headaches, muscle aches, and a low-grade fever, but they won't contract the flu from the vaccine. In fact, a study found that whether people received the flu shot or a shot with saltwater solution, they experienced the same post-vaccination symptoms: cough, runny nose, and fever. That's not to say that people who get the vaccine won't get the flu. Since the typical flu vaccine contains 4 strains of the virus, depending on what was most prevalent the year before, there's always a chance that you can get infected with a different strain. Nevertheless, a flu shot is still the best way to prevent the spread of the flu. So get your flu shots, people. I know there are some people out there who are allergic to them and can't get them. So for those people's sake, get your flu shot. Don't just not do it just because. But if you have a legitimate reason for not getting it, but don't spread the flu. It's not great. Nobody wants that. It's not fun. Yeah. So the next one, we've changed over to a different article here. So the myth is put butter on a burn. Ludicrous. Richard O'Brien, MD, an emergency medicine physician at the Moss Taylor Hospital in Scranton, PA, tells WebMD. Grandma's tried and true remedy for slapping butter on a burn is just adding unclean foreign proteins. Second and third degree burns, when the skin is blistering or white and without feeling, need to be treated by a doctor. First degree burns, when the skin is red but feeling is still normal, can be treated at home. You need to cool a minor burn. Run cold water on the burned area for at least 10 minutes, then apply an over-the-counter antibiotic ointment. Put a cloth over that, he says, and then you can apply another cold compress for pain control. A bag of frozen veggies works nicely. Never put ice directly on the skin, because it can hurt after a while. I'm bad about that. I do that a lot. So along with having an autoimmune disease, I also have chronic migraines that are not as bad because I do take medication for them. But sometimes they get really bad. I have really bad ones. And I have these compresses that are for your head. So they look like sleep masks. They even have cute little closed eyes on them that I keep in the freezer. And I have 4 or 5 of them. So that way I can change them out as I need them. And I just put those on. Usually they help. I usually try to put them on where I'm feeling the pain the most, because usually it's more the top of / front of my head, or it's my neck. And sometimes when I have really bad tooth pain, that can also trigger a migraine for me. So it just kind of depends. But I do tend to put it directly on my skin, even though I'm probably not supposed to do that. But it is nice sometimes because usually I'll start with it just at the top of my head, especially if it's at night and I don't necessarily want to wear it yet, but it will slide down while I'm sleeping and I wake up and it's just, I don't know, sometimes it's the best thing to wake up with, having slid down my eyes, because my eyes feel nice and cool and everything. So definitely don't put ice on your skin like me. And yeah, just, this stuff is... It makes sense. Don't put butter on a burn, though, because, that's just adding more foreign particles to something we don't want to get particles into, even if it's just a first-degree burn. Don't do it. It's bad. All right, the next one. Myth. Throw your head back to stop a nosebleed. I also used to have really bad nosebleeds when I was a kid, but that was also because I picked my nose a lot. I like to tell people this because it always cracks me up. I had a lot of weird things with my nose as a kid. I used to be able to eat spaghetti in a certain way that it would, instead of going down my esophagus, it would go up into my nasal cavity, and I could get it to go in and out of my nose at will. My brothers thought this was great and hilarious. But I also picked my nose a lot. When I was a kid, I also got a necklace stuck up my nose. I think I've told that story on the podcast before, but I did get a necklace stuck up my nose that I ended up sucking down. Nobody really knows what happened to that thing. And then the other thing was I used to get really bad nosebleeds because I picked my nose, but it would get to the point where I got them so bad that I would get these giant bloody clots in the back of my throat, and I would have to spit them out. And at first, I wasn't really doing it on purpose. It was just how I was. And when they started sending me home for nosebleeds, I, of course, was trying to do it on purpose after that, because, like, I love school and I love learning. I just don't really like people that much. So I didn't like being in a classroom with people all day. But, so I did try to, like, pick my nose until it bled sometimes. And then I would go and tell the teacher. And one time I did this, and my teacher, I think I was in 3rd or 4th grade, which is probably way too old to be picking your nose. I know, I was a gross kid. It's fine. But I told my teacher I had a nosebleed and I needed to go to the nurse's office, and she was like, do you have a nosebleed because you have a nosebleed, or do you have a nosebleed because you were picking your nose? So straight up called me out. I'm sure she was watching me do it. And knew what I was doing. So I was like, oh, okay, and just like got some tissues and went back to my desk and shut up about it. So I kind of stopped doing it after that. But hey, that's one thing to know about me. Once I'm caught doing something I'm not supposed to be doing, I usually don't keep doing it because I don't want to get caught again, unless it's like has to do with driving. I'm very terrible about that. But anyway. So the myth is to throw your head back to stop a nosebleed, something my mom actually had my brothers do a lot. We all got pretty bad nosebleeds sometimes. Don't put your head between your knees or tip your head back, O'Brien says. The latter is especially bad because you can breathe the blood into your lungs or get it in your stomach and vomit. Press the fleshy part of your nose, O'Brien says, and not the part where your glasses sit, lower than that, as if you are trying to stop a bad smell. Now, and this is the important part, press firmly for a complete 10 minutes by the clock. People don't do that. They let up every 3 seconds to see if it stopped, he says. 10 minutes. O'Brien says there are also medications and little nostril plugs for people who get frequent nosebleeds. If a nosebleed lasts more than 15 minutes, occurs following a serious injury, or is accompanied by severe blood loss, you should call your doctor or go to the emergency room. So there you go. Nosebleeds, dangerous, man. Don't be messing with them. I still get nosebleeds. Happens. Especially when my nose gets all, like, dry. It's not great. The next one is, if something gets stuck in your flesh, pulling it out is okay. This may be okay, O'Brien says, if the object is small, visible, and near the surface, but probably does not apply to errant fish hooks. You can cut the end of those and pull them out, but it's hard to do. I have trouble sometimes with a local anesthetic and a scalpel. An embedded fish hook may earn you a trip to the emergency department. If you do remove an object like a thorn, wash the wound well with soap and water, dry it, and bandage it. A puncture wound, especially a rusty nail, requires a tetanus shot if you have not had one in the last 5 years. Incidentally, the embedded object may be holding in blood. When in doubt, see your doctor. I remember being a kid, and I don't remember where this was. It was definitely in Kansas, I want to say. I still live in Kansas, but I don't remember what town this was in. But we used to have, like, a yard that I feel like we got splinters really easily from or something like that, or I don't know. But I remember the first time I got a bad, I don't know if this was the first time, but it's the first time I think I can remember. But one time I got a bad splinter and like it hurt really, really bad, and it was like pretty deep beneath my skin, but you could still kind of see like the top of it and everything. And it was at a time in my life where my dad was the one who stayed home and took care of me while my mom worked. I was the youngest, so I was the last one to go to school and all that. But my dad stayed home, and I had this splinter, and I was terrified, and it hurt so bad, and I went to him, and I was like, I have a bad splinter, and it won't come out. And so he literally just like pulled out his pocket knife and basically just like peeled it out. But I was so scared of that. That scared the crap out of me. He just so easily did that. So yeah, definitely splinters and all that do that. I've had to pull glass out of my foot a couple times, not big pieces of glass, obviously, but we have a lot of fan art that sometimes falls and gets broken, so that's that. But yeah, pull it out or don't. Be careful. Talk to your doctor. The next one is for cuts and scrapes, apply peroxide and leave open to the air. I'm not a fan of peroxide, O'Brien says. Some authorities even think it can kill the body's cells that are rushing to fend off intruding bacteria and germs trying to enter the wound. O'Brien prefers soap and water, or just clean water, to flush out bits of dirt and irrigate the wound. Even hose water will do. We go by clean, treat, and protect, he says. Clean a cut or scrape, apply antibiotic ointment, and bandage it. Some people like to let wounds air, but I find they heal faster if they are protected. More importantly, if they are bandaged, the person, especially a child, will protect them better. You can't imagine how many times people will re-injure the same place. I see it all the time. Bandaging makes it less likely that the wound will reopened. Any cut that goes beyond the top layer of the skin might need stitches. Generally, the sooner stitches are put in, the lower risk of infection. I am also notorious for picking at my scabs, which I also know is gross, but I have like a whole picking thing. I don't know what it is. I gotta pick at stuff, especially on my face. This is why I can't wear makeup, because I'm too, get it off my face. I don't want it there. But I am notorious for that, and actually right now I have a couple scabs on my chin, or underneath my chin, because I had plucked a couple of chin hairs that were kind of thick and big enough for me to pluck, and now I've either got an ingrown or something going on. There's something going on there. But yeah, I've been very terrible about picking at it, and I'm trying not to. Even as we speak, I'm sitting here trying not to pick at it. I probably should put a Band-Aid on it, but I don't know. But yeah, so don't pick at your scabs. It's really bad. And just be careful. There you go. The next one is, if you get shin splints, running more will ease them. That's the myth. Anyone who has run or hiked too much without conditioning has probably experienced shin pain. This is really called medial tibial stress syndrome, says Jim Thornton, MA, a certified athletic trainer and head trainer at Clarion University of Pennsylvania. Basically, the muscle attached to the shin bone is tearing loose. The inflammation or pain is a response on the way to healing. If you continue to pound the tears, or the tears, I don't know, Thornton tells WebMD it will not heal. The key is to have it evaluated, because it means your muscles are out of balance. If you run again when the pain lets up, dial back the mileage, because shin splints can end up in a stress fracture. So there you go. Heard it straight from the horse's mouth. And that we learned what that meant a couple episodes ago. Yeah, my philosophy, I don't exercise. I'm terrible at it. I hate it. But my philosophy is, if it hurts, you need to stop. Yes, sometimes it depends on what you're doing. You know, sometimes exercise is supposed to hurt. a little bit. It's helping you stretch those muscles and all that. But like, if you have like a strong pain in your ankle while you're running, I would probably need to stop. The next myth is, if you twist a knee or ankle, apply cold only. If you hurt a joint, what to do depends on the stage of the injury, Thorne says. The RICE acronym can help you remember how to immediately treat an injury. Rest the injured area, ice it for 20 minutes for the first 24 hours. Remove it for at least 20 to 40 minutes in between. Lightly compress it with a bandage and elevate over the level of the heart. What about heat? I don't apply heat if there is swelling, but if the swelling goes down in a few weeks, you can try a contrast bath. Heat, cold, Thornton says. If there is no swelling, heat may be soothing. Sometimes before a workout, heat can warm up that area too. If you cannot stand or walk, you should seek medical attention. Okay, so we already got the vinegar compress on a sunburn. I guess it's a sunburn. Okay. Put vinegar compresses on sunburn. Acid on a burn, O'Brien cringes. You shouldn't get a sunburn, he says, but if you do, sounds like my husband, but if you do, apply cool compresses. This is inflammation. Although I am a little reluctant to give everyone over-the-counter painkillers these days, I think ibuprofen is great for sunburn pain and inflammation. O'Brien says old-fashioned Noxzema also lowers the skin temperature. He's a fan. I don't even know what Noxzema is. I don't think I've ever used it. I usually put aloe on sunburn, so I'm going to look up Noxzema. Oh, okay, yeah, I've seen that before. That makes sense. All right, good to know. If you get a bee sting, you must squeeze out the stinger. Never do this. Squeezing the stinger may allow venom still in the sac to get into your system. Scrape the stinger out with a credit card, O'Brien says. Even those acrylic nails work if they are clean. If the person is getting red or having trouble breathing, dial 911. This can be serious or even fatal. Bees are a thing. They don't scare me because, like, I respect them and, like, nature needs them and all that stuff. But man, I might be allergic to bees. It's not something we've ever tested. And honestly, I would just not like to get stung by them, because I know EpiPens are very expensive, and I have been stung by a bee before, but not a venomous one. I think it was just a little honeybee that didn't have any venom, so like I assume it was fine, but I don't know. But it's just a tiny little bee, so don't be careful around bees. Don't aggravate them. Leave them alone. They're doing what they need to do. Don't bother them. And also, be careful with bee stings. You need to get the venom out of a snake bite as soon as possible. That's the myth. Cowboys may put stock in sucking the venom out of a snake bite, but it's a huge no-no. Do not use suction, O'Brien says. This can introduce more germs and bacteria. Also, don't allow the victim to run for help. This speeds the tissue-destroying or nerve-paralyzing venom. Remove tight clothing and rings from the victim and get to the emergency department immediately. Keep the affected area immobile and, if possible, below the level of the heart. I don't even recommend tourniquets, Brian says. People don't know how to use these. Fair. People may swallow their tongues during a seizure, which is a myth. It's commonplace in movies. Someone has a seizure and a passerby sticks something in the patient's mouth so that they don't swallow their tongue and block their airway. People can control their own airway, O'Brien says. Don't stick anything in there. If the person is outside, let them roll around on the ground. It's okay. When a person is having a seizure, don't hold the person down, as this can result in injury. Just remove sharp objects, glasses, furniture, etc. from around the person to prevent injury. So, careful around people with seizures. You gotta just kind of let them Like, you also, like, want to make sure that people are, gonna be comfortable and stuff, but don't, like, try to put anything in their mouths or anything, because, that would definitely block an airway, and that's not good. If you can get motion sickness, you can stop it by staring at a point on the horizon, is the myth. You could try staring at something, O'Brien says, but when you see someone who is sick, don't they usually have their eyes closed? Try to get to the most motion-free part of the boat or vehicle, and don't drink. You will just vomit up the fluid. If you are prone to motion sickness, take Dramamine. It may make you drowsy, but if you're sick, you don't want to drive anyway. That's pretty, like, Dramamine is great. It's wonderful. So I think it was like a couple years in a row. It was 1 year for my husband, and the next year it was me. But one of us in each of those years got really, really sick. And we're not even sure what it was. It could have been food poisoning, could have been the flu, who knows. But we had to go to the emergency room because we were throwing up so much that we were just completely dehydrated, couldn't keep anything down, even when we tried, to just drink some water or anything like that. Just everything came out pretty much immediately. So we had to go to the emergency room. Both of us did each time that this happened. Mine was on Valentine's Day, not last year, but a couple years ago, I think. And I ended up in the hospital after puking and pooping my guts out. It was gross. What a great Valentine's Day I had. And they gave us Dramamine as something that we could go pick up and keep for more nausea. But we both ended up only taking it 2 or 3 times before we were better. And then we just kind of kept it. And if you have a bad hangover and you've got some Dramamine will help that. So definitely, it's a great way to stop nausea. I love it. And it's also, not that bad to take. All right. But also, if you're going to take Dramamine, he is right. It does make you drowsy. Do not, drive anywhere or do anything. Have already called into work at that point, or be at work. Or whatever. I don't know. The next one, poison ivy is catching. Poison ivy is an allergic reaction to an oil called urushiol, released when the leaves of the poison ivy or poison oak or sumac are brushed or crushed. Usually nothing happens the first time. The big fun comes on the second exposure. Within 15 minutes, the oil binds to the skin proteins. If you can rub it off with alcohol or plenty of cold water, the rash can be avoided. It's not contagious no matter how icky the rash looks. Scratching the blisters also does not spread it. But while you still have the oil on your hands, you can spread it. Okay, so that's why people think. That's why you would probably have to get rid of the clothes you wore and everything, because you get the oil on it. Calamine or Burroughs solution can calm the blistery rash. An antihistamine like Benadryl can ease the itching, or at the very least will allow you to sleep through it. A cortisone cream can help soothe the itching as well. In severe cases, your doctor may prescribe cortisone medication by mouth. There you go. So that's an interesting one, actually, because I think that's a very widespread myth, is that, if you get poison ivy, you can give it to others. So you have to be and you technically can, but it's not because you have it. It's because the oil from it is on your skin. So, interesting. I learned something new. All right, and here's the very last one. A little bit of a shorter episode today, but I just thought this would be kind of fun to explore. And we all know I can babble for at least 5 minutes by myself, so maybe it won't be as short as we think it will be. The myth is that a cold steak can bring down a shiner or a black eye. Do you want grease and foreign proteins in your injured eye? If so, go along with Grandma and the cold steak. A bag of frozen vegetables is better, O'Brien says. A cold compress will bring down a smacked eye, but you will still end up with bruising. If you are poked in the eye or get grit in the eye, do not rub. Don't even try to remove a contact if you have one. If getting to the emergency room will take a while, a loose bandage to keep the eye shut will help the pain. If you get chemicals in your eye, flush them with fresh water for 15 minutes. Even what seems to be a minor eye injury can turn serious and may require a trip to the emergency room or doctor. Eyes are sensitive, man, so don't mess with them. Like, if something happens with your eye, like, just see a doctor as soon as you possibly can, which is not advice I follow. I frequently get eyelashes in my eye, but I think most people do. I think that's normal. But yeah, don't mess with your eye. Excuse me. I'm actually, so most people who know me know this, I do a lot of cosplay and stuff. If you want to check me out, it's EmpressWild at TikTok.com. And I have always wanted to try those contacts that can like change the color of your eye or change the look of your eye. And I've asked about them from like an eye doctor and what I would have to do. And she was like, oh yeah, we'd get you like a starter pack of like clear non-prescription eye contacts because I don't need a prescription, or at least they keep telling me I don't, but I probably do. They'd get you like clear contacts that are non-prescription, and you get to try them and get used to putting them in and taking them out and all that. And that costs, I think she told me, around $400 to start with. So I was like, I don't have $400 to do that. Part of me, every once in a while, gets really tempted to just buy a pack and give it a shot. But that scares me a little bit because I've never had to wear contacts. I've had to wear glasses before, but never had to wear contacts. So, you know, that's kind of, yeah, don't mess with your eyes. Eyes are a scary thing because they're so sensitive and they're so easy to mess up. You just don't want to do that. One time when I was a kid, I remember running into the corner of like a cabinet. We had like one of those, or what, did I run into it or like I poked myself? I don't know. I poked myself in the eye real bad with like the corner of a cabinet, or it was the corner of the door of a cabinet or something like that. It hurt real bad. I remember this. And then I had to wear an eye patch for several days afterward, which I thought was the funniest thing. So shit happens, but be careful, go see a doctor. And that should be the motto for this episode. Be careful, go see a doctor. But I think that is where we'll leave it for today. Like I said, kind of a short little episode. Thank you for taking the time to listen today. And if you enjoyed the show, please like, subscribe, and share it. Really helps me out. I don't necessarily need monetary support to keep this podcast running. It is completely a hobby of mine. I do enjoy just doing this for fun. However, if you did want to support me and give me like a little tip or something, you can go over to patreon.com/wildforestproductions. There you will find I post, well, I'm trying to catch up on it, but I've been posting a lot of things that I post on TikTok there. I've been posting my podcasts there. I've also been just kind of like sharing some other things here and there. So you can go check that out. My only tier is a $1 a month tier. It basically gives you my undying gratitude for supporting me. And if you would like me to shout someone out or shout you out or share something, it will depend on what it is, because I'm not going to do like political or anything like that. But if you do want me to shout out like an Etsy store or something like that, I can do that. So just let me know. And again, don't really need the monetary support, but we'll really appreciate it. Anywhere else, you can really find me under the name Empress Wild, Wild being spelled W-Y-L-D-E. Or you can find me under Wild Forest Productions with Wild spelled that same way. So yeah, thanks again, and I will see you next time. Thank you for listening to I'm Already Looking It Up. If you're enjoying the podcast, please like and subscribe. If you'd like to support the show, you can go to my Patreon at patreon.com/wildforestproductions. Don't forget to check out all the social links below. Thank you!